Ivermectin is an antiparasitic medication used to treat various parasitic infections in humans. However, I must emphasize that the use of ivermectin should only be undertaken under the guidance and prescription of a qualified healthcare professional, as its use can have potential risks and side effects. Indications: ivermectin is commonly used to treat certain parasitic infections caused by roundworms, threadworms, and other parasites. It may also be used in some cases of scabies and lice infestations. How to use? The dosage of ivermectin can vary depending on the specific condition being treated and the patient's age, weight, and other individual factors. It's crucial to follow the exact dosage instructions provided by a healthcare provider. Ivermectin is typically available in tablet form with varying strengths. For instance, if ivermectin is being treated to treat certain parasitic infections, the typical dosage might range from 150 to 200 micrograms per kilogram of body weight as a single dose. This dose might be repeated after a specified period if necessary. However, please note that dosages and treatment regimens can differ significantly depending on the specific condition being treated, so it's essential to consult a medical professional for accurate dosage recommendation tailored to a situation. Always seek guidance from a qualified healthcare provider before starting any medication, including ivermectin, to ensure your safety and proper treatment. Contraindications: ivermectin should not be used in certain situations, including but not limited to allergic reactions to ivermectin or similar medications, pregnancy or breastfeeding unless specifically recommended by a doctor, certain medical conditions or medications that could interact negatively with ivermectin. Precautions: inform your healthcare provider of any other medications, supplements, or medical conditions you have before starting ivermectin. Take the medication as prescribed and complete the entire course, even if symptoms improve. Follow any specific dietary instructions given by your healthcare provider. Side effects: ivermectin can potentially cause side effects, including but not limited to nausea, vomiting or diarrhea, dizziness or lightheadedness, allergic reactions such as rash, itching or swelling, abdominal pain, neurological symptoms, especially at high doses such as confusion or hallucinations.